sta facendo chiedere l'entrata.
In the last few decades, we've seen unprecedented temperatures, record-breaking temperatures, prolonged heat waves, and this has been linked to an increase in temperature-related mortality that would not have been observed if the temperatures had not been changing at the rate they have been doing over the last few decades. So we're using statistical approaches to understand how temperature extremes can change the risk of mortality. But this is not due only to mortality. It also depends on many other factors, such as underlying conditions, age, sex, socioeconomic conditions, the ability to adapt to extreme heat. For example, if there's access to air conditioning, cooling, if there's health facilities available to help prevent heat-related deaths. Elderly populations who may not have access to cooling systems, who are exposed to extreme heat within the home, who may not be able to take measures to protect themselves and hydrate themselves. That can also be a risk. It also depends on many other comorbidities, sort of underlying risk factors, for example. Europe is warming at twice the rate of the global average, and this is leading to a whole range of different health impacts. In Europe, heat-related mortality is a particular problem, given the aging population in Europe. We're also seeing impacts of climate change, changing the risk of local transmission of infectious diseases such as dengue, West Nile virus, leishmaniasis, as the climate conditions become more suitable for the disease. And we're also seeing more and more travel between Europe and areas experiencing endemic transmission of several infectious diseases which are of relevance to Europe. Well, we're seeing, for example, in the case of leishmaniasis, we're seeing a northward shift of the area of Europe which is now suitable for the transmission of leishmaniasis. We're also seeing, particularly in Northern Europe, increases in the length of the transmission season suitable for ticks. And in the case of mosquito-borne disease, particularly the mosquitoes, the Aedes albopictus mosquitoes that can transmit dengue, Zika, and chikungunya, we're seeing increases in the suitability for this mosquito in large parts of Europe, particularly in Southern Europe, but spreading further north. Certainly, we're seeing in the last few decades several outbreaks of diseases like dengue and chikungunya. We've seen outbreaks in France, in Croatia, in the Portuguese island of Madeira. In Italy, there was a dengue outbreak last year. It's certainly a threat that is becoming more and more serious, given the more suitable climatic conditions for the vectors. It's only a matter of time before the climate conditions become more suitable across large parts of Europe. And unless action is taken to improve the resilience of the European societies to resist local transmission of these diseases, then we could be facing a serious problem.
Perché lei ovviamente fa dentro di sé.